My top tip to GP Consortia would be, whilst health is always our business, as we go into this productivity challenge, data and information becomes the core of your business, and using it and leveraging it and understanding it is the key to local productivity gain and local health gain.
Top tips for success will be to not be called the GP Commissioning Consortium, because it alienates people and we need some of those other people to work with us.
I think clinical leadership is going to be key in this, and for clinical leaders to be credible amongst their peers, I think they have to continue to see patients.
GPs need to understand what leadership will be in the system. They will be required to become leaders of the system, and that's different from managing and buying and selling packets of care.
Getting a group of practices who can work together, have a track record of working together and can achieve things is absolutely critical. Even if that doesn't necessarily form an actual consortium, but is a locality that can make things happen for their patient, that's critical.
Well, from my point of view, Practice Managers Forum is key to me, and I would say if you weren't in a practice forum now, then find one in your local area that you can join, or if not, set one up. Try and set one up.
If we focus on efficiency in our healthcare systems, focus on good quality of care for them, then the rest can follow. That's the contracting, the counting numbers, the measuring outcomes, all that should fit around the principles that we're looking for, which is better systems of care.
It's recognising that GP commissioning's got to be about getting primary care right first and making sure that there's consistent, high quality services delivered from every general practice, and that we increase and expand the range of services that are delivered through general practice out in the local community.
I think we need to actually also build on relationships. I'm a great believer actually that you have a contractual side, but most of these things actually smoothed across by the professional approach, not just of us as GPs, but actually the whole healthcare system, of recognising and valuing the other skills that perhaps managers may have, which GPs may not necessarily recognise.
Relationships with clinicians, management, secondary care, social services, local authorities, engagement to every frontline clinician.
Communication is always key to a practice manager's job, be it with outside agencies, be it with your commissioning board, with your consortia.
Embrace all of your partners. We're not going to have a lot of money to do this GP commissioning with, and so using the skills of local social services, our local providers such as hospitals, and perhaps sharing functions as well, and starting to understand which functions we would share.
Keep the commissioning agenda as wide as you can. Keep all the commissioners you need in one place and stay with them.
GPs now have built good relationships, starting with practice-based commissioning. GPs speak to each other now, whereas before we used to work all independent in our own practices. Now we all talk. Practice managers talk, always have done. Encourage your GPs to go to the consortium meetings, you know, and build relationships.
I think also it's the fact that we need to take responsibility as GPs, that this is coming our way, whether or not it's a steam train and it's a juggernaut or whatever analogy we want to use. And whilst there are risks, and I'm not going to underplay the risks, and I think the risks are enormous, but this steam train is coming, and therefore we have to guide that steam train as best as we can and move the tracks as best we can to an area where actually we can actually get the best value, not just for patients, and patients are really important to us, but actually we've got to keep the whole healthcare system working, not just for us as GPs.